Hi everybody, I'm Ellen with Advanced Massage Therapies here in Carrollton, Georgia. And today I want to talk to you a little bit about what happens when you have a tummy tuck, how that affects the lymphatic system, and how as a therapist I'm able to help with the post-surgical recovery. So I have my model here with a shirt drawn out with a simple version of the lymphatic system. And everything in this quadrant is going to drain to this armpit, also known as the axilla, and everything in this quadrant will drain to this axilla, and then this is the belly button. Everything below the belly button in this quadrant is going to drain to the groin, also known as the inguinal nodes, and then everything in this quadrant drains to these inguinal nodes. So when you go for plastic surgery, the surgeon is going to make an incision somewhere around here, which is around the hip area, and he's going to come down somewhere around in the bikini line area and up to somewhere in the hip area on this side. Where he ends the incision is going to vary based on the individual and how much tissue he needs to remove. Then he's going to make another incision, and that incision is going to come up and across where the belly button is and back down around. And so he's going to take all of this tissue away. While this tissue is removed, if someone needs to have muscle repair work done, he's going to go in and do the stitching and do the muscle repair underneath. Then what he's going to do is he's going to take this tissue here, and remember all of this is cut away, so he's going to bring this down to the bottom incision, something like this. And then I've got some tape, so I'm going to tape this so it's going to represent the incision. Like this. And then actually that's pretty good because sometimes there may be a little extra tissue here. They call those dog ears. And he may have to go in and do a revision with those for second surgery. And then what he's going to do is he's going to cut a hole in the tissue and he's going to make a new belly button. So we're going to put that right here. There's her new belly button. So when a client comes to me for post-surgical recovery, it's much more than what I see in the Facebook groups where they're saying, oh, I just need to go get massages. It's way more involved than that. In the beginning, it is working a lot with removal of the swelling because there generally tends to be a lot of swelling. Depending on how much liposuction was done and the individual, and the particular techniques used by the surgeon, there may also be a lot of bruising in this area as well. So as a lymphatic therapist, what we're going to be doing is we're going to be following the natural lymphatic route. So as you can see, since the belly button has been moved and the old belly button is gone, everything above the scar is going to drain to the respective axillary areas. Everything below the scar is going to drain to the respective inguinal nodes. The lymphatics have been completely severed here. They cannot cross the scar. After surgery, they may be able to develop pathways across the scar. Sometimes that happens. So that pathway is completely severed at this point. So again, everything above the scar must go up. Everything below the scar must go down. Once we've gotten rid of most of the swelling, then we're starting to work with helping with any lumps, bumps, adhesions, and often, sometimes women, their tummy tuck, they may be pulled really tight and they're having trouble lifting their arms. So we'll also start to work with the connective tissue and help with the client being able to raise her arms up over her head. And I think I'm going to lose an arm. Let me put her little arm back on. There we go. Maybe, maybe not. Okay, we're going to leave it like that. Always something when you're working with a prop. So we'll be working with increasing range of motion so that the client can raise her arms comfortably over her head. Sometimes this tissue is really, really tight, working to get it so that it feels a little bit more natural and loose, working with those lumps and those bumps to smooth anything out. Also, one of the things that I do in my practice is I offer red light, yellow light, and blue light therapy. I can do different combinations thereof. Often in the beginning stages, what I'm doing is using red and yellow light to speed healing, reduce inflammation, and also do pain relief. If I'm seeing a sign of an infection starting, there's redness and irritation here at the scar, I can combine red and blue light therapy, and the blue light kills bacteria, and it is absolutely magical with helping with the infection. Another thing that is very important when you're working with your therapist is, as an experienced therapist, I know all about the healing process, what is normal, what is abnormal, and help you determine, are you healing on target? Is this supposed to be happening at this stage? If there is an issue, advising you to go back to your doctor. I've had clients in the past where I've had to advise them to go back to their doctor and have them take a look at the incision, take the bandaging off, and actually look, because there is a problem going on. So working with a very experienced and highly qualified therapist is incredibly important in helping you go through your healing stages. If you're looking for a therapist, what I recommend you do is go to the Lymphology Association of North America. Go to their website. Again, that is the Lymphology Association of North America. On their website, they have a listing of approved programs. Go to each approved program's website, and you can search for therapists who have graduated and maintained their certification from those programs. The Lymphology Association of North America also has its own certification. Generally speaking, massage therapists do not seek that extra certification. That is, I would say, 99.999% within the realm of the physical therapy and occupational therapy world. So the best way, if you're looking for a massage therapist, is, it's a little bit laborious, but if you go to the website, and then they will list each approved school's website, and then go through each school's website and look for their certified therapists. So I hope this little informational video helped. My name is Ellen. I'm with Advanced Massage Therapies here in Carrollton, Georgia. If you liked this video, please give it a thumbs up. Subscribe to my channel if you're watching on YouTube. I really do appreciate it. It helps the channel grow. It doesn't cost anything. And thank you so much for watching. Have a great day.